Well, so that's what we're going to move into next, Shadi, is your work in human trafficking and increasing education amongst the dermatology community writ large. We have had Dr. Merrick Elias on,
Hmm.
who also spoke about human trafficking from a private practice
Hmm.
viewpoint, and it was incredibly impactful and educational. And you and I just happened to share a ride one day, and you were talking about how you got into this and you were really passionate about helping the dermatology community understand the signs and symptoms and how patients may present that are being trafficked. So much so, Shadi, that you led the ad hoc committee for human trafficking for the American Academy of Dermatology. Talk to us about how that started and what your work, what were the deliverables of your work?
Yeah, thank you so much. And I'm so glad that you had Dr. Elias also share his perspective, because something that I always say is that public health initiatives are never the story of one person. They're the story of many people coming together. And I'm really proud of the dermatology community, our community, because I think that so many people have stepped up to contribute and do their part in their own way. Now, for me in particular, how I came to this work is, as I mentioned, I was recruited up to Mass General by my mentor, Alexa Kimball, to run the network of clinics, the division of our hospital that was charged with taking care of the most underserved patients and working with the primary care doctors and the local NGO, nonprofit organizations that were trying to help the community. And one of the biggest problems that we had in some of the pockets around the Boston community, especially, the most underserved communities, is gangs. There were a lot of people that were trying to get out of gangs, a lot of young people that were working with these nonprofit organizations. And one of the barriers was these tattoos that they had. And, the Massachusetts employment website actually lists tattoos as a barrier to employment. So, a lot of these young people needed to get these tattoos removed in order to be safe so that they would not be targeted, in order to acquire jobs, the kind of better jobs that they could get, and also just reintegrate into society. And so I realized that this was a way that our department, the dermatology department, could help in this multidisciplinary initiative to help these young people. And so, in true public health fashion, so you mentioned, Ted, that yes, I'm an alum of the Harvard School of Public Health, and I'm now part-time faculty there. The discipline of public health teaches us how to organize, because I think there are a lot of great people in the dermatology community. Certainly my mentors in residency, a lot of private practice dermatologists who were volunteering in their communities doing exactly this work for years, for many years before I came along. There were a lot of just good citizens of our community that were removing the tattoos, the scars, all these things. So when I came to this, public health teaches you to organize structures and to track their impact. And like you said, deliverables. And another theme of public health is to organize community stakeholders, to go find mentors, to go find teammates. So I was so fortunate that in our department at Mass General, I had the best mentor that a person could ever hope for with lasers was Dr. Rox Anderson, who, has helped to develop many of the lasers that we have in dermatology. So I went to Dr. Anderson and, sought his mentorship. And he said, Shadi, I'm so glad you came to me.